A major new study has revealed that the majority of Black Britons feel discriminated against, in particular in the workplace and in healthcare settings. Research from the civil rights group, the Black Equity Organisation, found that 65% of Black people said they've experienced prejudice while visiting doctors or hospitals. Over 60% felt they'd been passed over for promotion or employment. And 59% said they or someone close to them had experienced stop and search or wrongful arrest. Well, earlier I spoke to Dame Vivian Hunt, who's on the Black Equity Organisation's chair of trustees, and I asked her about the findings.
What we did was a qualitative as well as quantitative research survey of Black Britons from right across the country, and also non-Black Britons, to understand what their experience was across a wide range of areas: economic engagement and employment, criminal justice, healthcare, education, all the areas that are important in our lives. And what we learned was sobering. It is very clear that the presence of racism in a wide range of areas is still impacting many Black Britons' outcome and experience. And we hope that the rigor, but also quantum of research just continues to shine a light on these disproportionate outcomes for Black Britons.
I mean, there have been several reviews in recent years even showing evidence of racism in Britain. Were you surprised by what you heard in terms of people's experiences?
Particularly when you think about the public services, healthcare, education, criminal justice. These are the very institutions that are responsible for providing care for and looking after all of us, including Black Britons. But if you don't have good experiences or there's bias in your interactions with those communities, you don't trust those institutions. And so what we hope that the report does is shines a light on the still disproportionate and negative outcomes for many Black Britons, highlights examples and opportunities for change and improvement, and reminds all Britons that racism is present in our systems and culture, that it's bad for Black Britons and for all Britons, and that there's a lot that we can do to address these systemic changes. And we've been heartened by some of the responses to the report today.
The report said that many of the people questioned found that taking the knee, or Black Lives Matter, for instance, had made a positive difference to racism. Is that something that you feel is important?
Yes, because racism is a scar for all of society, not just for Black Britons. But when you look at the research, over 90% of Black Britons believe that it is a significant issue for the country, but only 40% of the non-Black respondents mentioned it. So we have to increase awareness and gestures and increase profile around anti-racism campaigns, like taking the knee, like highlighting data around the absence of Black and other ethnic minorities teachers. Having that data be in the public sphere and having real debates on it on programs like yours raises the awareness for everyone. The first step in addressing a problem is to acknowledge that systemic racism is an issue in culture and society, that it does have a negative impact for all of us, but particularly for Black Britons. And so if public representation campaigns by something as popular and loved by all of us as football and sport helps remind people of that, and role models who we respect are paying attention to creating an inclusive environment, then of course we think that is helpful. And Black Britons recognize that very strongly and positively in our research.
Okay, Dame Vivian Hunt, thanks ever so much for your time today.